Hello, CBS News viewers. I'm Dr. David Agus, and we're here in the CBS This Morning Toyota Green Room with Oscar Health CEO and co-founder Mario Schlosser. His company, Oscar, is working to change the health industry with technology-driven, consumer-focused services in the insurance field. Founded in 2012, 6 years ago, and based in good old New York City, it has approximately 250,000 enrollees and more than 800 employees. Mario, welcome to CBS.
It's great to be here, David.
So, obviously saying we're going to upend the insurance industry, bring technology, new ways of focus toward the consumer is something that is, all of us are passionate about because every person in this country has had difficulty with health insurance, whether it be on the billing side, the delivery side, you name it. So this came about 6 years ago. Tell us a little bit about just the story of how you got from your issues to solving them.
Yeah. At a high level, I think there's two issues with the US healthcare system, really. It's too costly. We spend almost a fifth of our incomes on healthcare as compared to 10% of GDP or so in most other developed countries. And it's too confusing. It's the last industry where a fax might be more useful than a smartphone. And so
that's fax, F-A-X, not F-A-C-T-S.
That's right, exactly. That's right. And so in 2012, I was going through my wife's first pregnancy. My son turned 6 years old yesterday, by the way. And thank you very much. And we were kind of having to navigate this complicated healthcare system, trying to find a maternity ward in New York City with a low enough C-section rates, trying to find the right OBGYN, understanding what this will cost us, and all these kind of questions that go through your mind when you navigate what should be a happy experience, pregnancy. And we thought that the health insurer is at such a unique vantage point in the healthcare system. It has really good visibility for all data flowing throughout the system and a good amount of control over the dollars flowing through the system as well. It sets reimbursement rates to providers. It tells members what it will reimburse for. If you combine these two things, and if you could create an insurance company that's liked by people as opposed to not liked by most people who use it, it would be potentially a very powerful, impactful force in the healthcare system. And that's what Oscar, I think, has become.
So you and your co-founder, Josh Kushner, put this together. And it was named for Josh's grandfather?
Right, great-grandfather.
Great-grandfather.
Exactly. Yeah, he emigrated into over Ellis Islands, I think, before World War II. And the immigration official told him, I can't spell your name. It was Joshua originally. He's named after his grandfather, great-grandfather, and said, I'm going to give you the name Oscar. And so Josh's mother once commented when Josh was in the ER after spraining his ankle playing basketball that this feels almost as Byzantine as the immigration system back in those days. That's how the name came about.
Oh, that's great. So obviously you've got a doctor who wants to deliver care, and you've got a patient who wants care, and you sit in the middle. So how do you make that middle point for you actually empowering for both ends of the spectrum?
Yeah, we almost want to be, we would like to be the entry points to healthcare for our members. Really, whatever issue you have, whatever question, worry you have emerging in your minds, we'd love for members to reach out to us first. If you're looking for a new physician, if you have some kind of worry about some pain you have, whatever else, check with us first. We would like to route you to the right place in the healthcare system. That's a really important aspect of how we build this.
When you say we, who is we?
We is either our virtual telemedicine physicians. We've got a couple dozen physicians working for us directly, delivering telemedicine, so you can chat with them.
So the real physicians,
real
not
physicians.
Just a bot.
No, exactly.
Right.
No. And you can see their pictures and things like that. So when they chat with you, when they talk to you, it is your concierge team. We reorganized the way we do customer service in a way that 6 people at Oscar will cover you as a member. And whenever you chat with us, you call us, you will get back to these 6 people. You see again their pictures, their names, and their backgrounds. One of these 6 people is a nurse. And so when you call, for example, or when you chat with us and you say something along the lines of, what is my deductible? What am I going to pay when I go to the doctor? The answer won't just be what the deductible is, but it'll be obviously what it is, and then can we help you with the underlying issue? Can we get you to the right doctor, or can we make an appointment for you? Can we solve the problem right then and there in the conversation? And being that entry point gives us the opportunity of really reorganizing the underlying healthcare delivery system in a way that's, I think, is quite unique. About 40% of first-time physician visits now in a place like New York City, we help make the appointments, we help get you to the right physician.
And is it data-driven? I mean, are you saying, listen, we're going to this doc because they're better for you, or are you just saying this doc is closer? I mean, is there real data behind it?
That's, again, the other superpower, if you will, of the insurance company. If correctly used, we can see, obviously, all of your health history. We can see the drugs you're on. We can see the lab tests you've had. We show those back to you, of course, in the mobile application as well. We share those with the physician, of course, as well. But we also use them to really say, okay, for your particular instance and issue, this physician might be the best. One quick example, when my kids, now 4 and 6 years old, had their tonsils taken out, we were looking for the surgeon who could best do this in New York. And it turns out there's a surgeon at Mount Sinai who's doing 1,000 tonsillectomies in, a 1 or 2 year period or so. And so frequency of procedure in something as routine as tonsillectomy is a good indicator of quality of procedure. And so my kids went to that surgeon, and we were happy with that. And so this kind of data isn't really accessible to someone trying to be smart navigating the healthcare system by him or herself. But we, as the insurer, can make it available to you and help you manage your healthcare in this way.
Yeah, and obviously, as you grow, your data will get better and better.
Exactly right.
So, I mean, speaking of that, I mean, you also mentioned something a little bit scary, right? Is that, you have our data. So you have our medical records, you have our lab data, and then recently, Alphabet, the parent of Google, just put $375 million into you. So that brings fear into many people's hearts when you say, you, Google, whoever, have data related to our health. We view health on this pinnacle. It's our own private data. So how are you kind of teetering that line of protecting our privacy and at the same time using data for good?
Yeah, it's an extremely important aspect of how we organize in the company, how we think in the company. And it's one reason why I like being an insurance company. We've been highly, highly regulated from the very beginning, and therefore making sure we treat your data incredibly confidentially and only ever use it to increase the quality or the value of your healthcare has been a given since the very beginning. We have tons of protections around the fact that only the people internally who should be looking at your data actually look at your data, our caregivers, our nurses, our customer service people. We put security around the physician web applications as well that really protect your data in a good way. And in my view, actually, in healthcare right now, we're suffering from too much siloing and too little availability of data rather than too much. You still really can't, oftentimes, on a physician-by-physician basis, see who's driving good clinical outcomes and who's not, who's driving high cost of care, who's very efficient at delivering cost of care. We still don't know for many tests even how well they really work in which situation. From a precision point of view, I remember one story, again, personally, a couple of years ago, my daughter was born, it's now 4 years old. We did one of those cell-free DNA tests, and she showed up with a suspected condition for T18. Edward syndrome will probably kill her when she directly after
rare
birth.
Genetic disease.
Exactly right. And so frantically, we started reading literally at the time, 3 available medical papers on the efficacy of this test. And I was sort of like in the figures of these papers and trying to figure out what this suspected really meant from a statistical point of view. And it turns out there was probably about a 60% probability it was a false positive that wasn't really being told to me by that company that administered the test, but it was that way from these papers as far as I could see. And she turned out to be fine. And so would we have more data in the healthcare system with more availability? Even from a research point of view, we could provide better statistical metrics for how new tests perform.
But you're not really designed for that. I mean, you're not designed to collect data in a systematic way with data standards, et cetera. You're designed for individual physicians. They can collect their own data on you, and then you could be a repository for that. So it's going to be hard to actually use your data to advance the field, per se.
Well, the ambition, again, the unique thing we have as Oscar is that we have much more member engagements than any other insurance company out there.
I don't know what that means,
more
member engagements.
It essentially means when you utilize healthcare, there's a 10x higher chance that you will go to Oscar first, talk to us first, ask us for advice, use our care delivery, even the telemedicine service, for example, than as compared to any of the insurance company out there. For
because
example,
of convenience.
Exactly right.
It's too hard to get to my doc, so I can just click on your app.
You push a button, and one of our doctors will call you back, chat with you. That physician will know how clinically complex you are as a member. He or she will know what your health history is, what your needs are, what medications you're on, how to really sort of like explain to you how to best utilize the healthcare system. That does, I think, over time give us unique insights into how to deliver better healthcare as well. I think we are in a unique position to, again, ask you about, are you getting better after having a certain surgery or procedure done in a way that can be very helpful for then improving the way the healthcare system functions, even the part that we don't control directly as Oscar.
One of the things I love about what you're doing is, you're incentivizing people to do the right thing. In our country, you can smoke, you can sit all day, be as large as you want, and then we as a society have the obligation to pay for the healthcare ramifications of your behavior. You're telling your patients, your customers, what do you call them anyway?
Members.
Your members.
Yeah.
That, listen, if you walk number of steps, I'll give you a discount or I'll give you a refund. That's a remarkable thing to incentivize, and I certainly believe in that. Are you going to make it bigger, that program?
Absolutely. I think that's, again, a unique aspect of being an insurance company. We have a fundamentally aligned business model with the interest of the member. If you are healthier or get healthy more quickly, then our cost benefits as well. And therefore, whatever we can invest in your health ends up benefiting really all of us. And paying you to walk steps is the very, very beginning of that. We can give you a discount if you book an appointment online. We can, over time, pay physicians more if they see patients on the same day basis. We can extract discounts from, let's say, radiology centers if we send members there in off-peak hours, and all these kind of things that you are used to from any other industry out there, from any other consumer-driven industry, but that into healthcare really hasn't evolved. Yeah?
So I guess one of the difficulties, if I were you in your shoes running a company, is that I can't do what I want. You've got all these legislators involved in a radically changing field, as we see affordable care good, affordable care bad, let's throw it out, let's build it up. How do you navigate when you don't even know what the sea is going to be like where you're going?
Yeah. Very unique aspect, again, of being an insurance company, for sure. I think in New York State, we were the first new insurance company in 20 years or so that got licensed from the greenfield in the commercial space. So there wasn't really a blueprint for how we would be able to grow.
Is that because nobody tried, or it was just too difficult?
People did try. I think it is too difficult to become an insurance company. There weren't many entry windows. One of the powerful aspects to me of the Affordable Care Act was that it created individual markets where we could really go to people, initially even like us, and over time really from all walks of life, who want insurance, want a better healthcare experience, and sell directly to them. And that individualization, I think, unleashes a power in the healthcare system of innovation, of more competitive pressure on the system that you just didn't have before. And so that was an important catalyst for us to get into the markets. Now, how do we navigate it? I think, to me, the number one thing is if we are building something that members like, if people like to come to us, if they think we're solving their problems, all the other stuff is noise almost. So we have to obviously be smart about which markets do we go into, how does our pricing work, and things like that. We, like others in the ACA marketplace, had to navigate the kind of starts and stops of this markets. But we're at a point now, 6 years in, where members really like dealing with us. We grow by word of mouth a tremendous amount in cities we've been in for a while. And we actually also are able to manage our medical loss ratio, the kind of medical cost divided by premiums we take in, the key metric of whether the insurance company is well run, to the point where it's really competitive to other insurance companies. And so it's all kind of working together now in a very nice way.
No, that's great. I mean, what's interesting, right? I mean, you have to ask this question when you talk to you is, right, you have a co-founder whose brother-in-law is the son-in-law of the President of the United States. You have a President of the United States who says, we're going to get rid of Affordable Care Act. You were built in the era of Affordable Care Act. There seems to be this push and this pull. And obviously, you guys are trying to look forward and say, where's healthcare going to be? And you're expanding, you're going into new states. Yeah. How do you put them all together, though? I mean, are you lobbying? Are you out there trying to make healthcare go a direction that you think is right as a company?
So we tell the story of why we think individualization in the healthcare market is very important, as loudly as we can. I mean, we have blog posts about that. There's a recent Wall Street Journal editorial that Joel Klein, one of the people that Oscar wrote with a professor from Harvard Business School, Rena Herzlinger, about how individualization, consumerization can work. And
I love that piece, by the way. It's a great piece.
Thank you. That's good. I will definitely tell him. I love that too. So we tell those stories loudly as we can, and we tell those stories to people who ask us for advice as well, and on Capitol Hill. But we are completely independent from any kind of connection there might be on the back end. That's never even entered the equation of my thinking, because fundamentally I think we are. We're pushing for something that will be good for the healthcare system, that is needed for the healthcare system, where many observers agree the sort of like odds employer-based system we've had in the US since World War II is an anachronism, is a thing of the past, something that's been holding us back in developing a more competitive system. And so as long as we can tell that story publicly and loudly, I think we're getting somewhere.
Look, I'm looking on the outside, right? You have one care group that you built in Brooklyn.
Yep.
And if somebody's on your plan for 4 years, you're not incentivized to care about their health care in 10 or 20 years. So how do we change America so we're not switching plans every 3 or 4 or 5 years, and you're incentivized for my long-term care? Go on Lipitor today, for example, because it's going to help you 20 years from now. Most insurance companies don't care about 20 years from now. How do we align the incentives?
That's the single biggest question I think we have in how to redesign US healthcare system. There's this very simple answer. If you give individuals the chance to buy their own healthcare, and I say this in the broadest possible sense, I always almost view Oscar as a subscription package for healthcare, not a health insurance plan.
Right.
You pay us on a monthly basis, and we organize the healthcare system for you in the best possible way. So if we give individuals the chance to buy their own healthcare with might be pre-tax dollars from the employer, with HSAs, HRA accounts, those all kinds of very different ways to do it. That will then unleash innovation and an ability for us and others to really say, if we do a nice job in managing your healthcare, you'll stick with us for 50 years. And then the incentives become really fully aligned. That's the place we want to be at. We always internally in the company say, we're developing our technology, we're developing our products to the point where members like us so much that they want to stick with us for 50 years, and they pay attention to us, to our advice, and to our incentives that we give them, so that actually they might think about changing their behavior in a way that they will be healthy in 50 years from now. That's the
the whole word insurance makes no sense, right? You're not an insurance company. You're trying to be a lifestyle company. You're trying to encourage the right lifestyle, educate, incentivize. That's not insurance.
The insurance function in that is an important aspect, because again, it gives us visibility to the data and control of the incentives. But yeah, that's the ambition. That's the overarching goal for sure. Do people like us? Do they make different choices based on advice we give them, incentives we give them? And will they be healthier in many years from now to come?
Do you have a special ops group or something who is sitting there and looking at new technologies? Should I sequence the DNA of every patient and tell them what diseases will happen and prevent them? Should I use this kind of scanner instead of that kind of scanner? Are there all these tech people sitting in a corner trying to advise?
So we don't try to do this in a special ops group. We try to do this with everybody really across the company. I think one of the most unique aspects about Oscar is that we still are at the very beginning of building all of this out. We've built our entirely internal infrastructure, so claims, medical management, medical outreach is all totally internally built. And it now gives us an ability of moving very, very quickly when we see new ideas, see new potential partners. And so we want everybody at Oscar, every engineer, every clinician, every physician to say, I discovered an interesting service over here. I saw a great app over there. I saw a great physician partner over there. Can we incorporate that into our service? That needs to be across the entire business. And yes, every single day there's a new idea coming from somewhere, and in the system that we think we can enable differently. I mean, just yesterday we had a 2-day hackathon on the team where, like other technology companies, we give people 48 hours to just hack a bunch of stuff together, see if they've get new ideas. And within 48 hours, we can build something that, for example, makes the app understand whether you currently are in an ER or urgent care clinic or a physician, and pops up new information related to where you are. And so that's now a feature we can build out and we can double down on.
So that geolocation figure, but it can also tell you if I've been to Dunkin' Donuts 3 times this morning, and be able to send you a notice, hey, listen, you got to watch your carb intake.
It could. That's not what we're doing right now, but at some point that might be possible as well. A lot of future health outcomes are, as you said, related to behavior today, and so at least to give you advice, not to force you to change your ways. I think that the latter one is not a good place to go, but to give you advice and make sure you're educated and you have really some idea of how this will all affect you. That can be very helpful, I think.
Do you have economists on staff? Is there somebody sitting there doing the modeling? If I tell somebody and I have a shorter ER visit, it'll yield this and that. Is there somebody who's doing that kind of war game planning for everything?
Yeah, we have a data team, we call the risk team, that essentially goes in and calculates which finely chiseled specialty a certain physician is performing in, what the total cost of care is when you go to a certain hospital, which sort of kind of behavior we see. We say, okay, here do we have too much ER utilization, here we have too much urgent care utilization. That's all happening in that team. And in fact, actually, many of the early people in Oscar in the team came from the hedge fund worlds and from global macro hedge fund that have been applying this kind of thinking to the global economy.
You know, it's the funniest field that I'm in, right? If I break my arm or my son breaks his arm, I can go to 5 emergency rooms. And I can't look up and say which is cheapest and which is the better outcome. Yeah. I just have to go to one. And in fact, I have no idea what it's going to cost until 2-3 weeks later when I get a bill.
Yep.
So there's zero transparency in pricing. And in a sense, hospitals can charge whatever they want.
Yep.
You obviously have an insight into the data.
Yep.
So you have an asset here, which is you're starting to know what hospitals charge what for what. And is that starting to guide decision making?
Yeah, so as I mentioned, about 40% of all the first-time primary care physician visits are now essentially occurring after the member came to Oscar, talked to the concierge team, looked in the app, looked in the website, and found that physician he or she wants to go to. When members then go to these physicians and we measure the total cost of their care over a longer period of time, then they go to physicians that on average are about 10-11% cheaper from a total cost of care perspective than if they went to an average other doctor in the same network.
Cheaper is a bad word in our field, less expensive.
Less expensive, exactly. But glad you said this, because we can, of course, correlate the costs and the total cost of care in particular that a physician is driving to also quality of outcomes, member feedback as well. And every study out there in healthcare that I'm sure you are familiar with as well, and also our own data shows that there is no correlation in the current system, or virtually no correlation between quality of outcomes and then the total cost of care. Hospitals can charge whatever they want for the most part. Physicians often don't have the information of whether they're driving a highly efficient total cost of care or not. That is all something we can do. And so in a place like New York City, we can go to the physicians who show up in our data both as driving happy members and at the same time lower total cost of care. We get them in deeper relationships to us. We tap into their medical record systems and are able to schedule appointments directly into their systems. We get more appointment capacity with them directly and can send members more to those physicians who then end up making you happier and healthier at a lower cost. And that's in a way already how the data work we've been doing is really paying off in a unique and in a meaningful way to you as a member.
That's awesome. Well, Mario, thank you for changing the health insurance system in a positive way. Thank you for collecting the data you're doing to try to actually improve all of our care and improve the system. And I think me and all the CBS News viewers are very excited to see where Oscar Health will go over the next 6 years. So thank you for visiting us today, and goodbye, everybody.